Hello, my name is Tara Leslie. I'm the course coordinator for Pharm 515. This is the Experiential Education Part 5 course for the PharmD for Practicing Pharmacist program at the University of Alberta. This course was previously known as the Specialty Elective. By the end of this session, you should understand the course objectives and the student assignments. You should be able to access the student assessments and apply the assessment procedures for your learner. Feel comfortable with the preceptor role and the responsibilities within the Pharm 515 course, and be aware of how to access additional resources applicable to the Pharm 515 preceptors. Let's get started with an overview of the course. Pharm 515, which was previously known as the Specialty Elective, is a student-developed 6-week experiential education course. The practice area can be in any professional setting within the scope of pharmacy, and it's selected by the student based on their own professional interests. Pharm 515 can be in a focused patient care area, such as an HIV clinic or a travel clinic. It can be in a non-direct patient care setting, such as research, drug information, leadership, or a professional association, or in a combination of some patient care activities and some non-direct patient care activities, such as a clinical with project combination. The course objectives are somewhat flexible based on the practice area. However, no matter the practices, students are expected to demonstrate competencies of professionalism and communication. Other educational outcomes can include competencies applicable to the practice setting, such as those associated with being a care provider, a scholar, a collaborator, or an advocate as appropriate. The details of the learning activities within the placement are developed by the student in consultation with the preceptor. There are 2 mandatory student assignments for this course, which I will review in the next few slides. The other assignments are negotiated between the preceptor and the student. They should be realistic for the 6-week course, yet appropriately challenging for a post-professional PharmD level of learner. The first mandatory assignment for this course is called the placement proposal. Using a template that I make available to the student, each student is expected to submit an outline that includes general information, the placement schedule, and a learning plan. The learning plan is the bulk of the assignment and requires the student to develop learning goals and map out some strategies to achieve their goals. Approximately 6 to 8 weeks prior to the start of the placement, your learner will engage with you to seek input or feedback into the specific activities they will likely be involved with or assigned. Then, approximately 4 weeks prior to the start of the placement, they will submit this assignment to me. Here is a screenshot of Part A and B of the template. In this first part, the student provides the details of the preceptor and practice setting, as well as a brief overview of the placement. If your placement has a site description on file, the student can just tick the box that says See Site Description. In Part B, they indicate the schedule. The student will select Standard Schedule if this Pharm 515 placement will be on a full-time basis in a regular placement block. They will choose Modified Schedule and elaborate appropriately if the placement is being completed on a part-time basis or there are any breaks within the placement of 1 week or more. In Part C, students detail their learning plan. Within the first column, the student can outline their learning goals. I encourage students to use SMART format, but it's not mandatory. Then, following the row corresponding to each goal, the student will map out how they will achieve each goal. In the second column, they will list some strategies and resources. An example of a strategy could be the specific steps in completing an assignment or completing a series of care plans. Examples of resources could be specific readings on guidelines or other literature, or maybe interactions with other professionals. So for example, say the preceptor informs the student there is an opportunity to write a case report on an interesting drug interaction involving a new antihypertensive. The student could develop a goal of developing academic writing skills by developing a case report by the end of the placement. The resources could be reviewing applicable literature to the antihypertensive and to the drug interaction, and also mentorship by the preceptor. Strategies could include reviewing literature on writing case reports and also reviewing examples of similar type case reports provided by the preceptor. For indicators of progress, the student is to reflect on how they will self-assess their progress with the learning goal. In our example, this could be their ability to draft the components of the case report in alignment with their strategies and goal, within an appropriate timeline and feedback from their preceptor. Another common example of indicators of progress can include self-reflection and journaling. The last two columns are for student self-reflection during the placement. After the third week, students are asked to jot down their thoughts on their progress so far. At the end of the placement, again, students are asked to write some reflective notes for their progress throughout the placement. The second required assignment is due to me at the end of the placement. Students are asked to use one of their learning goals and associated achievements as the basis for a learning record and an implementation record for their continuing competence portfolio with the Alberta College of Pharmacy. The preceptor's role is minimal in this assignment, so it's just more for your awareness as they may bring it up. As previously mentioned, all other placement assignments are chosen through discussion between the preceptor and student. As a preceptor, please identify possible assignments that allow your learner to develop the knowledge and skills that are highlighted in their learning goals and fulfill course objectives. Additionally, I encourage you to think of assignments that also add value to your practice, your site, or the profession. Students appreciate being involved with projects that have value. If possible, provide your learner with ideas while he or she is preparing their placement proposal. That way, they can be incorporated into their goals in advance. It is important to note that students in the PharmD for Practicing Pharmacists program participate in a poster presentation for their seminar course, which is offered in August and November of each year. Hence, if a project lends itself nicely to a poster presentation, we often encourage them to consider using it for their poster. They may ask you for guidance around initiating this. Students can also present a case report at the poster presentation. If they choose to do a case presentation, we do encourage them to obtain patient consent, and they may ask you questions about this. Also, please ensure that you support your student to obtain proper ethics approval if the project they are developing does require ethics. All of the Pharm 515 assessment forms are electronic and completed online. They are housed in the core ELMS, or previously known as RX Preceptor program. There are 3 different types of assessments depending on if the Pharm 515 is focused on patient care, non-direct patient care, or a combination of both. The midpoint assessment is completed after the 3rd week, or at 120 hours. And the final assessment is at the end of the placement, or after completing 240 hours. Both assessments ask the same questions and focus on the educational outcomes of the course. For both of these assessments, we encourage you to block some dedicated time and review each assessment with your learner. The midpoint allows a good opportunity to discuss areas of success and to really explore and coach on areas for improvement. At the final assessment, you can review your summative evaluation. For patient care placements, you will be provided with Assessment Form A. The educational outcomes that you will be asked to assess are professionalism, communication, scholar, care provider, and collaboration. For non-direct patient care placements, you will be assigned Assessment Form B. The outcomes within this assessment form are 3 outcomes of professionalism, 2 for communication, 4 outcomes related to scholarly activities, 2 for collaboration, and 1 for advocacy. For combination placements, the outcomes are professionalism, 2 for communication, 3 for scholar, 5 related to the care provider outcomes, and 1 for collaboration. This is referred to as Assessment Form C. For all outcomes, the same rating scale is used. Exceeds an acceptable level of performance is the highest rating. You can provide your student with this rating if you believe they really are performing better than expected on the skills and behaviors associated with an outcome. Meets an acceptable level of performance is appropriate if your student is performing as expected on the skills and behaviors that are listed with the outcome. Needs improvement to reach an acceptable level of performance is appropriate if your student needs improvement, but you feel that with some hard work they will be able to achieve the outcome. Not meeting an acceptable level of performance should be used if your student is demonstrating significant difficulty or major deficits in the skills and behaviors associated with the outcome. I would also encourage you to reach out to me so we could further discuss. Unable to rate at midpoint can be used if the outcome is something that you expect to see the student perform in the second half of the placement, but at this point at midpoint they haven't yet had the opportunity. Not applicable is rarely used. If you feel that a particular outcome is not applicable to your practice setting, I encourage you to really review the associated behaviors. Sometimes an outcome can seem to not match a context, but after reviewing the listed behaviors, you may realize that the outcome is actually very applicable. However, you can select not applicable if the behaviors listed are something that the student truly would not have the opportunity to demonstrate within the placement. To access the assessments, log into your Core ELMS account. The website is on the slide here if you need it. Once you're in Core ELMS, you can click on the drop-down menu from Evaluations and then click on Evaluation of Student. That should then link you to the assessment form. Very briefly, I'll go over some general preparations for your student. If you haven't previously attended a preceptor workshop or completed the online preceptor training program, please complete preceptor training by accessing the UBC eTips module. If you are precepting a patient care placement, you're also required to complete the patient care process module. Both of these can be accessed in the Training and Resources section of our website, and the link is provided there for you. If needed, you can review the course syllabus. It's a long document and really targeted for students, but if you'd like to access it, it is available for you as well. There are many additional resources also available on our website, such as the precepting manual and various recorded educational sessions if you're interested. Let's go through a few other preparations. Keep in mind that your student will likely reach out to you up to 2 months before the placement for input and feedback on their placement proposal. Other important preparations include finding workspace and planning for any additional site requirements. For example, if your learner will need IT access or a swipe badge, please discuss this with your site administrator for arrangements. Also, please remind your coworkers and leaders and managers the dates your student will be at the site. For NetCare access, AHS sites are centrally coordinated, but for non-AHS sites, the student is required to complete NetCare access forms, which will then require approval by your site manager or access coordinator. Please keep in mind that NetCare use for functions other than direct patient care, such as research, may require review from your ethics board or special authorization. I suggest that you plan to arrange your schedule such that there are opportunities for you to have discussions with your student and provide formative feedback. Also, please plan ahead to make time to observe the student's performance for some activities to help inform the evaluations. Thank you very much for your commitment to pharmacy education and for welcoming a student into your practice. Please feel free to contact me if you have any additional questions. Thank you.